Bismillahirrahmanirrahim. So the next topic we are going to discuss is nephrotic syndrome. Just like nephrotic syndrome is also characterized by the glomerular inflammation which derives the disease. In nephrotic syndrome, proteinuria is typically greater than 3.5 grams per day. The pathogenesis is mostly immune mediated, which means there are immune complexes which deposit on the glomerular basement membrane or food processes of the podocytes, resulting in the damage, causing an increased release of proteins in the urine. Certain systemic diseases such as systemic lupus erythematosus, amyloidosis, and certain infections can also result in the nephrotic syndrome. So coming on towards the signs and symptoms of nephrotic syndrome, proteinuria being the most important one, it is more than 3.5 grams per day. So proteinuria in nephrotic syndrome can be either selective or non-selective. In selective cases, only small proteins are excreted in the urine, whereas in the non-selective, irrespective of the size, almost all the proteins are excreted in the urine. So ultimately there is hypoalbuminemia, which means decreased concentration of albumin in the blood. Likewise, there is hypogammaglobulinemia. Then there are some coagulation disorders which are also found in the nephrotic syndrome, such as renal vein thrombosis, which was once thought to be the cause of nephrotic syndrome. But now we know that the nephrotic syndrome actually results in the renal vein thrombosis. This is mostly due to the loss of prothrombin and antithrombin. So these patients can present with thrombosis and thromboembolic phenomena. Nephrotic syndrome is also characterized by the hyperlipidemia, which means increased concentration of lipid in the blood, and hyperlipiduria, which means increased excretion of lipids in the urine. There is generalized edema, which is of pitting nature. So pleural effusion and ascites can also be present in the severe cases. So there is injury to the glomerular basement membrane and food processes of the podocytes, which makes the proteins to cross into urinary space and then into the urine easily. So proteinuria is typically greater than 3.5 grams per day. So once the higher concentration of protein is released into the urine, there is a deficiency of protein in the blood. This deficiency actually leads to decreased plasma osmotic pressure, which shifts the fluid from the intravascular compartment to extravascular compartment. So this results in edema. One more thing that you have to remember is that due to increased leakage of the fluid, there is depleted blood volume, which results in decreased blood pressure. When the blood pressure is decreased, there is decreased glomerular filtration rate, which activates renin-angiotensin system, resulting in increased water and salt retention, elevating the blood pressure. The edema is typically of pitting type and it's generalized edema. The patients of nephrotic syndrome have an increased cholesterol level in the blood as well as increased triglycerides and increased VLDL levels. This is particularly occurring due to the fact that there is an excessive protein loss in the urine and the liver tries to generate more proteins to compensate the levels. So there is increased synthesis of lipoproteins, which ultimately leads to decreased catabolism of lipids and abnormal transport of lipids, resulting in hyperlipidemia. So unlike all these, there is a decrease in HDL. So once there is hyperlipidemia, excessive lipid is lost in the urine, which is known as hyperlipiduria. The patient is at hypercoagulable state due to increased loss of antithrombin 3, which inhibits coagulation. So these patients are at hypercoagulable state and more liable to have thrombosis or thromboembolic events, such as renal vein thrombosis. The patients with nephrotic syndrome are also prone to certain infections such as staphylococcus and pneumococcal infections, which is due to the loss of immunoglobulins in the urine. So this decreases the immunity and makes the person more susceptible to microorganisms invasion, which leads to infections. Coming on towards the causes of nephrotic syndrome, the causes can be divided into primary and secondary causes. Primary means the problem lies within the kidneys, whereas the secondary means the problem lies elsewhere, such as in certain systemic diseases. So the primary causes include membranous nephropathy, minimal change disease, focal segmental sclerosis, membranoproliferative glomerulonephritis, and IgA nephropathy. We will discuss each of these diseases separately. Secondary causes include diabetes mellitus, which definitely damages the kidneys. Then there is amyloidosis, systemic lupus erythematosus, and certain drugs such as gold salts, penicillamine, and certain NSAIDs that can damage the kidneys, resulting in nephrotic syndrome. Certain infections such as hepatitis B virus, hepatitis C virus, HIV, malaria, and syphilis can also result in damage to the kidneys, causing nephrotic syndrome. If you have any questions, do let us know in the comment section. Thank you.